Ladies and gentlemen, I'm Dr. Tettey Doe, psychiatrist in the United Kingdom. I present to you 4 key skills on this masterclass. And these skills are necessary to pass your exams in psychiatry in the United Kingdom and elsewhere. Differential diagnosis, management, risk assessment, and communication skills. I would like to say that these skills have been the product of many years of studying and looking at these examinations in the United Kingdom and how things have been managed, and it's to help you to make sure that you pass your exams. The differential diagnosis can be based on the ICD-10 or currently the ICD-11. So you can look at that when it's referred to, look at those skills. And in ICD-10, and looking at ICD-10, you have 1 is organic disorders, 2 is psychoactive substances, 3 is schizophrenia, 4 is mood or affective disorders, 5 is neurotic or stress, somatoform disorders, 6 is behavioral associated with physical conditions, 7 is adult personality and behavior, 8 is mental retardation, 9 is psychological development, and 10 is childhood and adolescent emotional and behavioral disorders. As the Royal College of Psychiatrists is using both the ICD-10 and the ICD-11 to do examinations, as far as I'm aware, at this moment. Now, the second skill is management. Management involves 1, information gathering, 2 is the delivery of that information, and that depends on the location, whether one is examining someone at home or in the ward, and also in the delivery is the input, whether from the outpatients department or under home treatment team or assertive outreach team or community mental health team or CMHT, or whether it's a CPA, care program approach, in which case one looks at the assessment itself and also the coordinator and also how to review the care plan. Thirdly is psychological. In management, psychological, immediate management of anxiety, etc., and the behavior, immediate management, and the long term. For example, CBT, cognitive behavior therapy, CAT, cognitive analytic therapy, DBT, dialectical behavior therapy, and etc. Fourthly is looking at the biological aspect of management, the immediate and the long term. And also, last but not the least, is social. Social is also immediate and long term. So that immediate social support, for example, in the area of psychoeducation, etc., DVLA advice, and then in the long term can involve support that can be given, accommodation is an example. So all this under management. The next is risk. Risk is very broadly. There are, first of all, static factors that affect risk, like past criminal history. Secondly, dynamic factors, which are current currently ongoing, like substance use, and these can change. Thirdly, there's actuarial risk, that is statistical risk. 4 is clinical risk assessments, which one does. Fifthly, consider the risk factors. 6, the risk that is posed to the self, to others, and from others. And 7th is the risk assessment tools that one needs to use. And 8th is risk management and the principles of risk management. Under risk factors, one could look at 1, the previous history of the person. Secondly, the personal factors, example, demographics, personality, and employment. Thirdly, one also needs to look at illness-related factors like psychosis, substance use, and compliance and treatment. Fourthly, the present mental state of the person, appearance, behavior, speech, etc., etc. The thought form, perceptions, insights, cognitive function. Fifthly is situational risk factors like the type of employment, vulnerability, whether there's learning difficulty, elderly, etc. So these are all part of the risk assessments. And also risk posed, as I mentioned earlier, risk posed to 1, to self, like deliberate self-harm, suicide, neglect, sexual, physical, emotional, finances. Secondly, risk to or from other adults, could be sexual, physical, emotional, financial. Thirdly, risk to children or vulnerable people. This could be sex, physical, emotional, finance, and neglect. And fourthly, risk to property, whether private or public, fire, setting, neglect, safety, security. These are all important. Now, the next is the communication skills. Communication skills are very important in this process. And I'll just touch a bit on a few things which you can expand by reading more. Under communication skills, 1 is your appearance and manner. It's very important. Usually in an exam, there should be no handshake. You need to sit up straight and smile. 2, your question style. Start with open-ended questions and then continue with close-ended questions, and be motivational in your questioning. 3, you need to be well-placed and competent, and compliments also. Well-placed compliments to the patient. Fourthly, saying things like, that is right. And fifthly, mirroring the patient's emotional states or sitting position, posture. 6 is dealing with anger. You need to agree with the points that are raised without arguing with the angry patient. 7, conversational style, quiet and loud. You need to look at it. 8 is answering the question that is set in an exam. 9 is marking. Leave with concentration on your next station and leave the marking for the examiners to do. It's very important. So I wish you all the best with these 4 key areas, that you do well. Thank you for your attention.